Why do some stroke survivors experience vision changes? Have you ever wondered why some people who have had a stroke experience changes in their vision? This can be a surprising and challenging aspect of recovery. When a stroke occurs, it can damage specific parts of the brain that are responsible for processing visual information or controlling eye movements. Vision is not just about the eyes gathering light. It also involves the brain interpreting what we see. When blood flow is interrupted during a stroke, brain cells can die in areas involved in vision, leading to various visual impairments. One key reason for vision changes after a stroke is damage to the visual processing centers in the brain. The occipital lobe, located at the back of the brain, is the primary region for visual processing. If this area is injured, it can affect how we perceive color, size, shape, and interpret visual stimuli. Strokes that affect one side of the brain can cause loss of vision in the corresponding halves of the visual field in both eyes. This condition is known as homonymous hemianopia, where half of the visual field is lost. Additionally, damage can lead to smaller blind spots called scotomas or a loss of a quarter of the visual field, known as quadrantanopia. Since visual information from both eyes is combined in the brain, a stroke on one side can impact vision in both eyes. Another factor is the disruption of eye movement control. The brainstem is responsible for controlling eye movements, balance, and coordination. Damage in this area can lead to problems such as nystagmus, which is involuntary rhythmic eye movements, strabismus, where the eyes are misaligned, and diplopia or double vision. Oculomotor dysfunction can also occur, affecting the ability to track and focus on objects. These issues can make it difficult to read, perceive depth, and maintain balance. Some stroke survivors may experience visual spatial neglect, where the brain does not process visual information from one side, often the side opposite the brain lesion. This neurological attention deficit can manifest as ignoring objects or parts of the body on the affected side, which is not an eye problem but rather a brain processing issue. Secondary eye issues can also arise after a stroke. Stroke can affect blinking and eyelid closure, leading to dry eyes, irritation, and increased sensitivity to light. These symptoms may contribute to blurry vision or discomfort. Moreover, a stroke can impact visual memory and interpretation. Beyond just sight, vision involves the brain's ability to interpret and remember visual information. Stroke survivors may struggle to recognize objects, judge distances, or read due to impaired visual memory and processing. Research indicates that vision changes after a stroke affect about 1/3 to 2/3 of survivors, depending on the study. While some improvement often occurs in the first few months, full recovery is less common. Rehabilitation through occupational therapy, vision therapy, and adaptive strategies like scanning techniques can help survivors maximize their remaining vision and improve daily functioning. In summary, vision changes after a stroke arise from damage to brain areas that process visual information and control eye movements, as well as neurological deficits affecting attention to visual stimuli. These changes can be complex and varied, reflecting the brain's central role in vision beyond the eyes themselves. Professional evaluation and rehabilitation are essential for managing these effects and supporting recovery.